Welcome back to the Anxiety Slayer podcast. I'm Shan here with my good friend and co-host Ananga. This week, we're responding to a question from our Facebook group that we actually get asked often, and it's how to prepare for and face medical testing and the results that come after without being completely terrified. And before we begin, we want to give a big shout out and thanks to our new patrons, Robin, Dawn, and Craig, for supporting our work together. If you want to become an Anxiety Slayer patron, you can visit patreon.com/Anxiety Slayer. Welcome back, Ananga.
Hey, Shan.
Well, this topic resonates for both you and I, facing medical tests and outcomes. I'm glad that we're going to be able to speak about it as I sit here 2 hours before my next doctor's appointment, trying to keep my anxiety at bay. Where do we begin with this fear, this triggering?
I think it's a challenging one because usually the last thing anyone wants to do is think about it or confront it. And the tendency is to want to be as far away from it as possible. But one thing that really does help is asking yourself what's at the root of the fear so that you can get support that's tailored to your concerns, because this isn't something that's the same for everyone. Sometimes it might be rooted in an unpleasant childhood experience with a doctor that felt, unfamiliar, or again, it's very personal. It could be a whole host of different things. Sometimes we're uncomfortable with scrutiny. I don't enjoy eye examinations because I don't like people that close to my face.
I'm there with you, sister, and that's where I'm headed. That's where I'm going.
We've talked about this before, but once I realized what it was, that really helped. We might have a mind that has a nature of spinning stories about an undesirable outcome. We might feel triggered with anxiety over our mortality. It could be so many different things. Or it might be the tests themselves, for example, a fear of needles or a discomfort about being confined in a scan. So it's not the same for everyone. And if we can get some help to understand our personal concerns, that's the first step to getting support to put to rest a specific area. Because if it is just one key area, but it's leaching into our mind and making us uncomfortable, we can find help for that.
I find it helpful to be very direct and honest with the healthcare provider, whomever it might be, that, hey, just to give you a heads up, I get a little bit uncomfortable and anxious during these kinds of tests, or I might ask you a lot of questions just to feel a little bit more comfortable. Just very, very open about how I feel in that moment. And I find that when I do that, I'm treated with an extra level of care because I've been honest about where I'm at.
Yeah, that's a point I was going to touch in on later. About that, speaking for ourselves and how important that is. Yeah.
And then, of course, if you need to, before you have your tests, before this happens, this is a really good time to speak to a trusted friend or do some tapping, or if you have a spiritual mentor, counselor, whomever it might be, to just kind of work out whatever it is that has you spun up.
Yeah, because these things come around. We have dental visits, we have eye tests, whatever other tests, blood tests. I can't remember how many blood tests I've had in the last few years. They come around, and sometimes I think there's an opportunity there for us to really get specific about what we need support with so that they can come around more peacefully and we can take them more in our stride.
And if you're one of the people that is uncomfortable with the testing and the scrutiny and just really holding tight, waiting for the results of something, this is just a very huge invitation to soften toward yourself, to take a breath and remember that you're not alone, that most people are uncomfortable with medical scrutiny, that none of us probably really like being focused on in this place and having our bodies examined and looking for problems that may or may not come up. So this is why it's so important to give yourself compassion and be sweet with yourself and be kind and accept how you feel as well. Don't call yourself a baby. Don't berate yourself because of the fear that comes up. Just be sweet with yourself.
Yeah, I think our languaging around these things is very important to be aware of and change. And often we'll use words that have been used towards us when we were younger, and they didn't feel good then and they don't feel good now. So, definitely an opportunity there to look at our internal dialogue and how we frame these situations. I find it really helpful to consider the motive, the context of things. If we're visiting a doctor, we tend to go because we have a concern, and their intention is to help us with that concern. It isn't to make us feel anxious or uncomfortable. And they have a set framework that they're working within of what they consider is reasonable testing, and to them represents good care. And I think it's helpful to frame it in that way, that the intention of the medical profession is to help.
I love that. That is such a important point to bring forward because those of us who dance with health anxiety forget that. We forget that these healthcare practitioners got into their practices because they want to support other people and they want to help them get well.
Yeah. And I think, when we're younger, we don't have the experience to figure that out. And, I'm thinking back to times when I felt anxious about my health, and I think it stems back to when I was in my teens and I had some quite extensive medical testing from older men, older white coats. And I can remember my mum being busy at work, so I had to go and have quite an unpleasant test on my own. She put me in a taxi and I went to the hospital, and I came home from the hospital in the taxi feeling very uncertain. The doctor was quite dismissive and unpleasant, and it was an invasive procedure, so the whole thing felt really awful, and that set a mood in me for many years. But, now I'm older than most of my doctors. Also, advocacy and ethics around patient care have improved largely. But, I don't need to feel like a young person in the hands of an older kind of authority figure who's being gruff or dismissive. That's changed. And I think that's another area where it's important to look at things specifically. Where does this come from? And is it relevant now? What's changed now? And how can I settle more with what is now?
Hmm. That makes me think of so many different stories and helps you get to the root
Yeah,
of what's going on for sure.
yeah.
Let's talk about how we can ease anxiety around the testing itself, whether that be the fear of needles or confinement in a scan or any of the tests going in for the eye exam that I'm going in for today. And what helps with the tests?
I think there are practical things like what time of day helps. I like to have appointments in the morning if possible.
Yeah.
And then I've got the day ahead of me. I think bookending appointments can be really helpful, where you go and deal with the needful, and then you have something sweet the other side of it that carries you through it. Otherwise, tests can feel like a roadblock, like a dead end, like today, this is happening, and you can't see anything beyond it. So, just practical things that put something beyond it and put it in perspective and don't let it be bigger than it need be. Then I think it depends on the nature of the test. I was getting some blood tests a few weeks ago, and there was a young girl next to me. She was terrified. She was
Aw.
terrified of needles, and I was so upset for her. And in the end, she had to leave. She couldn't do it,
Aw.
and she was going to have to come back the next day. And I was so concerned for her that now she was going to go home and feel awful and have to come back and face it all over again. And I knew there was a high chance if I could help her with tapping, but it wasn't appropriate. She was younger than my daughter, so I just wanted to walk over and give her a hug. And I knew if I could stand at the end of the bed and do some tapping for her, I would likely be able to help her feel more calm, because I've done that with others many times before, but it wasn't appropriate. So that was really hard for me to sit and keep quiet.
Oh, sure.
I did see her on the way out and I recommended Rescue Remedy. And a nice nurse recommended that she got some numbing cream from the chemist so that she didn't feel the insertion of the needle. That was a good tip. Confinement in a scan. I had an MRI scan a few years ago where fortunately my head was out of the scanner, which was quite nice.
And I remember you telling a story of the meditation that you were doing
Yeah.
while you were in there to keep yourself more calm and relaxed.
Yeah, that's what I decided. It was a good opportunity to challenge myself on my meditation practice.
Sure.
And I was able to take myself off to a really good place. And it was one of the sweetest meditation sessions I've had.
Mm.
That's where we bring our life experience in. We bring our spiritual practices in. We bring the things where we tend to our roots and we tend to the bigger picture of the fact that we have a mind and we have a body and they can both cause us disturbance. But we're the soul. The more we can think like a soul, the less we suffer. But it's work. It's a lifetime's work. Yeah, that was a wonderful experience for me. I was able to take myself off, and it really helped.
One of the things that I've noticed in myself over the years is before these tests and is that I really have to address and dance with the what if or worst case scenario thinking. And it's gotten better and better because of our work together, because of the tools, because of what I know now. But I will take things to the nth degree with something, meaning that, oh, is this diagnosis going to be X? And if so, are we going to have to like have a spaghetti dinner to raise money in order to pay the bills for whatever's gone wrong? You know, that kind of thing. Like, wow, that escalated quick.
Very specific with the dinner.
Right.
But yeah.
You know, it's just like, oh, am I going to have to start a GoFundMe or, you know,
right.
And it's like, oh, honey, please back up. And I was talking with my very favorite healthcare provider who has since retired at the time, and just letting her know how my mind can get away with me sometimes. And she grabbed my face, hands on each side of my face, like you would a little kid.
Mm.
And she said, Shan, you are healthy.
Oh,
You've got this, you know. And then she took her hands back and I thought, I love you. Like,
yeah.
Because in that moment, I needed somebody to say, snap out of it. And she did so. And I miss her. And I'm meeting with a new general practitioner in a couple of weeks, and she's been highly recommended. And so I'm grateful and hopeful that that we get on well, and that I have a new partner in my health and future health.
Also very important to bring forward that if we have the option to explore different healthcare providers in whatever field we're seeking assistance, really important for that. I love my current dentist and I love my current rheumatologist.
Well, it just makes such a difference, doesn't it?
It does. A bit of humanity and also to have the self-respect and the courage to air what's on our mind, because anxiety thrives in the dark, and when you share it with somebody, you're shedding some light on it, and that alone can help. We often talk on the podcast about Ayurveda, India's ancient science of life, and different mind-body types, and we've shared before that this Vata type can be more prone to anxiety, and the Vata type's also incredibly creative, and that means it has a fantastic imagination, for better or for worse. That means it can create brilliant art or music or poetry, writing, whatever your particular skill set is. And it can create a horror story in your mind or a worst case scenario in your mind at lightning speed with incredible detail. And one thing I found helps when waiting for test results, which I had a spell of a few years ago where it just went 3 weeks of waiting, then more testing, then 2 weeks, then more testing, then a wait for surgery, then a wait for the results after that. I think there was a period of about 3 months where I'd have like these 10 to 18-day spells of just waiting. And I found that what really helped was to be creative on the positive side, because we have that heightened creative energy. So sitting projecting what could be wrong and what might happen that we don't know the facts of yet is exhausting and puts a great strain on the body. So what I chose to do at that time was colouring in. I bought some beautiful pencils and colouring books, and I would listen to audiobooks. I listened to the Bhagavad Gita, I listened to different stories, classes, audiobooks. So I had good stuff going into my mind, but also that extra kind of occupational therapy for the mind of colouring. I even liked the smell of the pencils, the wood. It felt like my senses were locked down in a better place. So that's a practical thing that can really help.
Earlier, you brought up Bach flower remedies, which is something that we've shared many times in this podcast, and the potency and efficacy of Rescue Remedy, a combination of 5 remedies known to relieve stress and shock and anxiety. This is something that I recommend you carry with you in your purse or leave in your car or wherever you might find that you need a little bit of support, whether it be driving, whether it be going to a doctor's appointment or what have you. This is such a lovely, natural way to support yourself.
Yeah. And find the formula that suits you. There's a spray which is really handy to keep in your pocket or keep with you. There are dropper bottle formulas. I always have a dropper bottle in the kitchen. That's a good way to add Rescue Remedy to drinks and also to make the formula last longer. If you have a flask where you sip hot water throughout the day, you can put some drops in there and it will benefit you throughout the day. I recommend using them in the run up to any tests or procedures or appointments and afterwards, not just on the day. Definitely on the day, but also give yourself some support ahead of time and after time if you feel a bit stirred up. And there are some other remedies in the Bach Flower collection too that are really good for anxiety. There's aspen is a remedy where if you feel shaky, trembly about things, you might have bad dreams or find that your heart's racing or that you feel that you're sweating for no apparent reason. You just suddenly feel that kind of clammy anxiety, shaky anxiety. And that's for when you feel anxious, but you don't really know why. It can come on quite suddenly and it can be quite intense, but you can't quite put your finger on why. And then there's mimulus, which is for the type of fear where you do know why. There's a specific cause, like a medical test or waiting for results. It's a specific anxiety. And then there's white chestnut, which helps with persistent unwanted thoughts, where we're preoccupied with some outcome or something that's going to happen, something on our mind. They call it the broken record remedy, where our mind just keeps serving up those thoughts. And if you are interested in white chestnut, you can also get it in the Rescue Remedy combination that's called the Nighttime Remedy. That's the 5 usual remedies, but with white chestnut added as well. So it's a more cost-effective way to do that. And you don't just have to take it at night. It's recommended for night for those looping thoughts that can disturb our sleep. That's why it's in there. But if that's the way your anxiety serves itself up to you, then take it day and night, no problem. It won't make you sleepy. It's not a nighttime remedy because it's sleepy.
No, it's very gentle support. And Bach flowers, oh, I'm just incredibly grateful to have them in my medicine cabinet especially for medical tests and doctor's appointments. So I'm glad that we get the chance to share that again. And yeah, and if you want, depending on if you're like Ananga and I, you might want to buy a full set and mix your own combinations, which I've done many times, and I know you have too.
Yeah, for myself, for friends and family. It's a beautiful, it's not hard to learn a few key ones that are beneficial. There's a beautiful collection of remedies, and I think I've had them in my home for about 30 or 40 years now. So I always feel that, when you've had something around that long, it stands the test of time, then it's worthy of mention.
And of course, EFT tapping is going to help you. It can be used in so many different ways to just calm the fear of the tests, to calm being with the doctor, that white coat anxiety that so many of us deal with on occasion when we go to the doctor. And tapping, one of the best uses of tapping for me is when I'm in the exam room by myself before anybody comes in. and I'll just tap on my collarbone and breathe and tap and breathe. And then they come in and I feel like, okay, I've taken good care of myself, and now they're here, and now let the games begin, right?
Yeah, because there's a lot of overwhelm with this kind of anxiety. And if we feel overwhelmed, we feel helpless. But if we've got something we know to do, like carry some rescue remedy, learn some techniques, learn some basic tapping, then it gives us more control in what might feel like a situation where we feel helpless and out of control. We've got several tapping sessions on our Patreon. We've got our guided SOS tapping sessions for bringing down heightened anxiety. And we've got some of our health anxiety tapping sessions there as well at patreon.com/anxiety slayer. And I'll just share here a really quick and easy way to use EFT tapping if you're feeling triggered. I know sometimes when we feel really anxious, it feels all the more overwhelming if you get too much advice, too much incoming information. That can also feel overwhelming. And then thinking, oh, now I've got to learn something new. I just haven't got the headspace for that. That can, put us off trying. So I'll share the simplest way to use EFT tapping. And that is where you don't need to use any words or think about it at all. You just use the tapping points, which you can find at anxietyslayer.com/EFT. We have a diagram there. And you can use it in scenarios. Here's one example I used it with a client with. They were very concerned about their blood pressure and what that might mean. The mind had the story. So the blood pressure monitor became a trigger. So they would sit and tap with the blood pressure monitor until it lost emotional significance. It lost that anxious thing. And all they needed to do was get the thing out, stick it next to them and tap until they felt neutral about it. So sometimes if we have health anxiety, we might see something on TV, we might see an advert, we might read something, we might hear something, an uncomfortable conversation might come our way, and those things might feel like triggers. If we tap then, tap when you see the advert. You don't need to say anything or do anything, just tap the points to diffuse the response in your body and mind to that advert. Or if sometimes we're looking on Instagram and something comes up and we might think, oh, I wish I hadn't seen that. Or we might just, feel some anxiety rising. Then leave it there and tap. What happens when you tap is the anxiety goes down and your understanding increases for why the thing upset you in the first place. So it gives you information and more peace of mind. So that's a really simple way to use EFT. And then, as you said, Shan, just picking one or two points that help, like the collarbone point, just tapping there and taking deep breaths. There's a very specific reason why that works that we won't go into here, but it does work. And if you're really anxious and in a place where you can move, pace up and down, tap on the point, take deep breaths, and it will take the edge off the anxiety very quickly.
And we did mention the importance of talking with trusted friends in preparation for or during or after the tests and the results. It's so soothing, helpful, and loving to be able to share that fear with somebody that you trust, somebody who's grounded and can hold space for you, who loves you, who just lets you voice and externalize what you need to share. And when that happens, you feel so much less isolated, and you can open yourself to receiving that sweetness and support. It's just an incredible gift.
Yeah. And also, something that really helps in that regard with friends is to ask someone to come with you, a trusted person, a partner or a friend to come with you if you're receiving information for clarity, for another pair of ears there, just a very practical thing, but also for advocacy so that you feel supported in making choices. A lot of medical anxiety comes from us feeling hemmed in like we don't have a choice. And autonomy is so important. And I know for me, as a young person having medical interventions, there was no question of autonomy. And I know that that's where some anxiety came from. And a mentor told me years later, when I was facing some quite a challenging diagnosis, he said, inform yourself and make your decision that sits right with you and don't let anyone else tell you otherwise. Gather your information and do what's right for you and stick with it. And that really helped. But sometimes we might need another pair of ears that are going to pick up something we don't. Also, when we're anxious, we have an anxious filtration system where we hear things and flag them in the mind. And there might be positives coming through in a medical setting that we're missing that somebody else will catch.
Sure.
Really important for advocacy and autonomy to feel that we have a voice and to feel that we have a choice takes away so much anxiety, particularly for those of us in our middle and older years where that wasn't always such a thing. And we might have had negative experience with that in the past.
Hmm. Yeah, my husband has kindly come with me on a few of my doctor's visits over the years, and just having him there made all the difference. Just not having to be in the waiting room alone, and when possible, having him come in with me if they would let him, made all the difference for sure.
Yeah. And we're allowed to ask for what we need.
Hmm. Thanks, Ananga. I'm glad we had this conversation today, and thank you to all of our listeners. If you want additional support for health anxiety, you can join our Patreon for our SOS tapping sessions or any of our other tapping sessions available, or you can explore our health anxiety course at anxietyslayeracademy.com.